Hello, my name is Al Ali, and I'm here to talk to you today about your upcoming breast augmentation and what your experience will be like before surgery and after surgery. A couple of days before surgery, you come in, we give you a set of instructions, and we also write you a set of prescriptions we'd like you to pick up before surgery, not the day of surgery, because it's important not to have to go around and chase medications when you're recovering and somebody is taking you home. So breast augmentation almost universally is a go home procedure. So you will have the surgery and then you'll go home. The day of surgery, you'll come in and you again will meet me and some of the people in the hospital like nurses and anesthesia, have you signed some more consents. And then once you get to the operating room or you leave the area where you're prepped, you really don't remember very much about it because the medications we give you kind of make you forget. So the first time you'll probably remember things is in the recovery room. When you wake up, if I put a bra on you at all, it's a very loose bra and it's definitely not an underwire. I have it on for your comfort. There may be some foam underneath it with the bra on. The foam is there just for your comfort. If you don't like it, take the foam off. And again, I'm not interested in having anything really tight. It's just something to make you feel a little secure. We do not expect you to be in bed any longer than just recovering from anesthesia. So that same day, we want you up and around and walking at least once after surgery. When you are recovering for the first 48 hours or so, we inject everywhere where we operate a local anesthetic that is very good at reducing discomfort. That helps reduce your pain level significantly. And it has really changed the way people tolerate surgery, whether it's a breast augmentation or any of the other procedures that we do. We don't want you to use narcotics, so we give you very few of those, but we give you a bunch of other medications that are non-narcotic. And this local anesthetic is just really remarkable at reducing discomfort. So you'll feel something, but it's not at the level where you're just kind of having really hardcore pain. That is very unusual in today's world. The next day, we want you up and around doing most things. Some people think that if they don't move, it's better, but it's actually not a good idea. So it's a little bit like having a Charlie horse. In the morning, it hurts a lot, but because you get up and walk around, by evening, it feels a lot better. And then by morning again, because you haven't moved overnight, it hurts more again, then it gets better as the day goes on. With breast augmentation, it's pretty important for you to get up and do most things that you do. You'll find that most things that are at the level of your shoulders and below, you could do pretty well. You'll feel some discomfort, and the more you move, the better and quicker you will get better. The less you move, it's going to take you that much longer to get better. Some of the other medications that we give you are to reduce swelling and such, but you get that with an instructional video as well, separate from here, as to how to use these medications to help you recover. Probably see me within a week or so after surgery, and I'll check and make sure things are going well and such. Generally speaking, I'm going to ask you to increase your activities. We don't use any external stitches, so there are no sutures to remove. There's usually just glue on the incisions. We let that come off on its own. Unless it's something that's bothering you, then we can consider removing it earlier. As time goes on, some people really get back to normal very quickly. Discomfort is a very subjective thing and it differs tremendously from individual to individual. Some people take a little bit longer, some people take a lot longer. Use your body as a biofeedback machine. If it hurts, don't do it. If it doesn't hurt, you can do it within reason. So I don't want you to go out and run a marathon. If you are interested in going back to the gym and doing lower body stuff, being on a treadmill, maybe not running. Running generally hurts because it jogs the breast and it hurts, but you can walk or you could use a stationary bike. We don't want you to do anything really heavy as far as weights go, just very low weights till we give you permission to move on from there. Right after surgery, the breasts are a bit swollen. There may be some bruising. these things get better over time. So there is a little bit of a change in both shape and size over time. And in certain kinds of breast augmentation, the shape can change significantly over 6 to 8 weeks and sometimes even 3 months. If you're waiting to invest a lot of money into your bras, don't do that till 3 to 4 months out, till my breasts settled into their final position. And we would tell you when that happens. Because of the way we do our sizing, meaning we decide on what size based on your desires and what I can accomplish, most people are pretty darn happy with what they have, as long as they were honest with me in what they wanted from surgery. So it's a procedure with a very high satisfaction rate, and hopefully you will have the same experience.